Castellano. That was great. It is my absolute pleasure to talk to you all today about the exciting things that we're doing here at the section of GYN Oncology in LSU New Orleans. And so our mission is to raise the bar for women's cancer care in South Louisiana using a four-pronged approach of promoting evidence-based care, improving access to cutting-edge treatments, promoting education of the public, our patients, other providers, trainees, ourselves, and advocating for the women of the state who face a gynecologic cancer. In talking about what we're aiming to do, I think it's important to discuss where we're coming from. After the storm, the women of New Orleans in the general region really struggled with access to subspecialists. So leading up to 2016, there was one very dedicated GYN oncologist who worked with LSU, and he primarily practiced last at Interim LSU Hospital, and he was very beloved, but did retire shortly before I started. When I onboarded, there were actually fewer GYN oncologists in the state than there were at the hospital where I did my training and fellowship. Access to a gynecologic oncologist is a critical component of cancer care. And when discussing gynecologic cancer outcomes, GYN oncology care is linked to better outcomes and longer overall survival. So the very severe shortage of GYN oncologists in the state was a really big barrier. I saw a lot of really wonderful physicians trying their best to provide the best care possible, but without GYN oncologists available, women were really suffering. So I've been really lucky to work with a very practical and forward-thinking chair, Dr. Peacock, and the leadership at the LSU School of Medicine, who've been very, very supportive as we've tried to grow the division and improve women's cancer care. We were pretty easy to demonstrate the need, and through a strong partnership, especially with LCMC, we've been able to recruit and build a program that I think meets and even is exceeding and starting to take that need to the next level and be really progressive, forward-thinking, and advanced. We now have 3 fellowship-trained GYN oncologists, 1 physician's assistant who works with us at UMCNO, and a strong collaborative relationship with some tremendous colleagues throughout the state in medical oncology, radiation oncology, palliative medicine, obstetrics and gynecology, and beyond. Because of the support and vision of the leadership at LSU and LCMC, we've been able to build a really robust program that serves 5 hospitals at several different clinical sites. And we continue to look forward to hopes of bringing excellent women's cancer care to more rural and remote areas of the team. Next slide. All right. So this is some of our team, and I'm sure we're not going to be able to be as comprehensive as we'd like. I'm Dr. Jernigan. I am from Annapolis, Maryland, fell in love with New Orleans in college, went on to do my training in Philadelphia and then Johns Hopkins in Baltimore and then the Cleveland Clinic. I was really excited to have the opportunity to return to New Orleans. Dr. Nair joined me in 2018. She's a local. She did attend medical school at NYU and residency at Emory in Atlanta before attending fellowship at Mount Sinai in New York. She's extremely high standards and is a fierce patient advocate. She settles for nothing short of the absolute best when it comes to her patient's care. And I think she's really helped us not only do our work, but do it very well. Dr. Tara Castellano is our newest addition and just joined last week. She is a local, attended med school here at LSU in New Orleans before residency at UNC Chapel Hill and fellowship at University of Oklahoma. I had the inside scoop with her as one of my good friends actually trained her in fellowship, and I know she's a phenomenal surgeon and doctor, and we're really excited to have her on the team. Myself, Dr. Nair, Dr. Castellano are the 3 LSU Health New Orleans gynecologic oncologists. Shauna Moran is our PA. She's been working with our team for a few months, but she has already helped make a tremendous forward progress. She's quickly become the heart and soul of our UMCNO service, and our patients get to know her and have really enjoyed the continuity and compassion that she brings to the table. She has a strong background in primary care and has filled in a lot of gaps for our patients who may have primary care needs while on treatment or survivorship. Other faces you may see in our clinic include our nurses. Claudia joined our team at LSU Healthcare Network and works with us at our Metairie and St. Charles offices. She's organized, kind, and smart. Very excited about having her on the team. Junquel is our nurse navigator at UMCNO. She is one of the most get-it-done people I have ever met. She's a true gem and really dedicated to helping patients. Kristen is our fantastic surgical scheduler at the LSU Healthcare Network. Kristen Cordes is our LPN at WestJeff, and Lise Tabor works with us as well. And she's our CMA at LSU Healthcare Network and has been a real asset to the team. With a new cancer diagnosis, getting accurate idea of what exactly is going on is fundamental to doing the right things. We're in open communication with our pathologists and radiologists to help ensure we don't miss an opportunity to improve your care. The LSU Radiology Department actually has a fellowship in women's imaging, so have been extremely helpful, and the pathology department is also similarly extremely communicative and collaborative. Aggressive cancer care requires aggressive treatments. So we are very excited about some of the intensive care options that we have. So that basically means if we give you an intensive medical or surgical treatment to try to fix your cancer, if you need an ICU, for example, at UMCNO, they've got a fantastic ICU service. And that's really supported us in trying to be aggressive with your cancer. We've been very fortunate to have a very strong relationship with some of our collaborative surgical and procedural specialists. I will say our support by colorectal surgery, surgical oncology, urology, and interventional radiology has been extremely strong. And they've really helped us care for women with cancer in a very multidisciplinary fashion. Our radiation oncologists are wonderful. We work closely and communicate regularly with radiation oncologists throughout the state who are extremely talented. We've been particularly pleased with the LCMC team, especially Drs. Zachris Vincent and Dr. Harmon, who Dr. Zachris actually has a special interest in GYN cancers, and we communicate with her regularly. We work very closely with palliative care specialists, and LCMC has really invested in a phenomenal palliative care team at UMCNO, and they help you be clear about your wishes and goals no matter where in the cancer journey you are, and make sure that you're not suffering too much, and that we're adhering to your wishes. While we often do administer our own chemotherapy, we work very closely with some very talented medical oncologists in the community and at LSU. To LSU Healthcare Network, medical oncologists deserve special attention because of their specific interest in treating women's cancers. Dr. Augustin Garcia is a medical oncologist with a special interest and expertise in women's cancers. He trained at the University of Illinois and then University of Southern California. He served as a national leader in drug development for breast and ovarian cancers and is the section chief of hematologic oncology at LSU New Orleans. He's also the Charles W. McMillan III and Richard Paul Grace Chair in Cancer Research. He's a local and a national leader in women's cancer care and has been a tremendous asset as we build our section. Dr. Michelle Locke has been with LSU New Orleans since 2012, and she's a special interest in breast and gynecologic cancers, as well as health disparities in cancer care and minority clinical trial enrollment. She's involved in setting up a survivorship clinic at UMCNO and is very interested in quality of life and survivorship issues. And then finally, genetics is increasingly becoming an important part of what we do. Alex D'Angelo is an instructor and a master in genetic counseling who teaches our students, residents, and us all of the time. And she's extremely helpful in sorting out tricky genetic questions and valuable resources. So it's a huge team, and certainly this is not comprehensive, but I think we're very set up to successfully provide advanced cancer care. Next slide. So we see patients at 5 different hospitals. At UMCNO, we see patients and administer chemotherapy at the Cancer Center, and we have a busy surgical practice there, as well as at East Jefferson. And we see patients at the Metairie Multi-Specialty Clinic as well. Next slide. West Jeff has been a recent expansion, but is quite busy. Dr. Castellano will have a big footprint here. We've also opened clinics recently in the St. Charles Toro area to better serve the Garden District. We also service Children's Hospital when we have young girls who have needs that meet ours, which is hopefully not often. And then in Lafayette, there's a lot of cancer and no GYN oncologists at this time. We have 2 fantastic GYNs that we work with very closely out there to get the women in that region the cancer care they deserve, and you'll be hearing more about that in a second. All right, so we see women with cancers, as you've heard of the reproductive organs. We also treat women with complex GYN conditions. We help coordinate and plan complex obstetrical deliveries, such as with invasive placentas, as well as when other cancer specialists have issues that involve our organs, like colon cancer involving the ovary or things like that. We also help counsel and care for women with a genetic predisposition to cancer, and we treat women in Louisiana and beyond. So we know that women who participate on clinical trials have superior outcomes. They live longer and do better. However, only 5% of women with gynecologic cancers do this. The primary method or path for improving the treatment options for women with cancer is participating in these clinical trials. And participating in these trials does help others. If the women in our region participate, that means that the science that trial generates applies to the women in the region. So you're not just helping some abstract woman in some random part of the world, you're helping your neighbor or your daughter or whoever might in this region might get cancer in the future. But we never want you to feel pressured. We are excited to have these trials open and available because we always want the best options available for you. We have several trials open at UMCNO and at East Jefferson that cover ovarian, uterine, cervical cancer in the early and late settings. These trials really span the gamut from immunotherapies to stem cell treatments to targeted therapies, treatments for rare tumors, symptom control, and evaluating health disparities. If you want to learn more, you can visit our website too. The Steel Magnolias program. So as I discussed, we're really trying hard to get women in Lafayette taken care of. And there are a lot of women in this region of the state that do not have GYN cancer services. It's a big ask for to get them to come all the way to New Orleans to visit us regularly, especially in the surveillance setting. And traditionally, GYN oncologists remain involved in these women's cancer care. So we've set up, we've been lucky to have this relationship with two talented gynecologists in Lafayette, Dr. Holly Provost and Dr. May Thomasy, and Suzanne Viator is their nurse navigator who's helping us coordinate this project. But most recently, to reduce the financial burden and the time burden that's required for them to come back and forth, we've developed this shared telehealth for multidisciplinary gynecologic cancer care survivorship program, where they actually go in and get the physical portions of their exams in their office. And then we telemedicine in, review imaging and labs and make recommendations sort of pertinent to their cancer specific care. One of Dr. Nayer's large efforts has been to coordinate what I believe is likely the most comprehensive and well-run multidisciplinary tumor board in the state. Experts from a variety of backgrounds, such as medical oncology, radiation oncology, radiology, pathology, genetics, palliative medicine, OBGYN, and other surgical disciplines, and a variety of other sites, and not just LSU New Orleans, but our colleagues in Baton Rouge and Shreveport regularly join in. They meet twice a month to discuss complex cases. This promotes high quality evidence-based care, which translate directly to improved treatment and outcomes. We know that our patients are getting top-notch care because of this process, and we believe it is helping to elevate cancer care throughout the region. Another exciting thing we did recently in collaboration with our surgical oncology colleagues is the first HIPEC case for ovarian cancer in New Orleans. This is HIPEC is hot chemotherapy, where you perform surgery to remove ovarian cancer, and then you instill heated chemotherapy into the abdomen and pelvis. Data continues to come out to suggest that this is actually a really important thing that we can do to improve ovarian cancer survival, and so we're really excited to offer it in New Orleans. Education is a huge part of what we do, and we're very proud of our efforts here. The LSU OBGYN residents are a tremendously devoted and hardworking group of young doctors, and it's a great pleasure to help them grow and become the next generation of OBGYNs that serve the women of our state. Our medical students rotate with us regularly, and we work with them closely in clinical settings, as well as in designing and executing research projects. We have a really great group of medical students who collaborate to perform research projects and stay on track, called the Women's Health Research Consortium, and this has resulted in an increase of research projects and publications. We're dedicated to educating each other. I learn from my partners every day. Dr. Nayer teaches me things all the time, and I'm very excited to have Dr. Castellano join us because I think fresh blood is a good thing. Dr. Nayer's tumor board, as well as a regional journal club that she makes happen a few times a year, where we meet and discuss articles with our colleagues, even at competing institutions, really help keep us all fresh. All right, next slide. If you want to get involved, please visit our website. We have information about how to get involved and who to contact. You can follow us on social media. We're on Twitter, Facebook, and Instagram. And yes, we do have a fund, and we use the money from that fund to help women with cancer in critical ways when money might be an issue, as well as to support the educational mission of our section. And then, next slide. And finally, just a little plug, there is a race to end women's cancer, which usually happens in person, but this year is obviously going to be virtual. If you're interested, it's called Move for Her. You can register for it online at foundationforwomenscancer.org or moveforher.org. And